So, good evening, friends, all the teachers, mentors, and the players. So, welcome you all to the eighth episode of this Big Q in association with OSN. So, this is the signature tune of the Brain Teasers. And this is for you, all the postgraduates.
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं है।
तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर खोल पर खोल पर
So, good evening once again and welcome back. So, today is the last episode of our preliminary rounds. And from the next round, we will start with the quarterfinals. So, as you all know, Brain Teasers is an online platform for hosting the quiz for all the ophthalmologists of the country. And Big Q is specially for all the postgraduates across the country. In this third season of Big Q, there were 8 preliminary rounds, and out of those 8, today's is the last round. After this, there will be 4 quarterfinals, two semifinals, and one final which will be played. So, episodes would be on alternate Wednesdays at 8 p.m. The team is extremely thankful to the team of the quiz masters who have toiled hard to create a wonderful experience of learning with fun. For today's episode, we welcome Dr. Annapurna Ma'am, who is a postgraduate teacher at Aravind Eye Hospital, Pondicherry. Dr. Lipi Chakrabarti, she is an associate professor and HOD, Department of Ophthalmology at CCM Government Medical College, Durg, Chhattisgarh, and also the director and medical consultant at Lipika Netradham, Durg. Our third quizmaster is Dr. Urmil Chawla, Professor of Pediatric Ophthalmology, Strabismus and Oculoplasty Unit at RIO PGIMS, Rohtak. Our last quizmaster is Dr. Akanksha Pandit, who has done her MS in Parvara Institute of Medical Science, Loni, Ahmednagar, and is presently pursuing her fellowship in medical retina at Sankara Eye Institute, Shimoga, Karnataka. As we all are aware, such a mega project is not possible without a strong financial support from the pharma company. Microvision has been our steadfast partner since last 3 seasons. Our sincerest gratitude to Ashok sir, Mr. Kumaran, and Mr. Navneet, and all the field force of Microvision for all their support. And this is a video from their team. Before we start with the format and the rules, we would like to thank Mr. Sai and the Numerotech team for smooth and flawless execution of the quiz and in computing results and all the other backend work which goes behind every episode. So with this, let's quickly see what are the rules. So today is the last round, that is the eighth preliminary round. and the best 5 performances will be calculated. So there are two platforms, Kahoot and the Zoom. The first is the Zoom platform for the live quizzing, and the second screen is the Kahoot to answer the questions. Mentors are requested to log in from the separate screen only on the Zoom platform. So in today's episodes, though we have 4 quiz masters, questions will be of 10 sets only, means total 50 questions will be there. Each set will have 5 questions. You will get 10 seconds per question, and there will be no negative marking. And fastest finger first is the criteria who scores the highest marks. So these are the prizes for the postgraduate category in the finals. These are for the mentors, and for audience prizes, these prizes are every episode. So before we start the quiz, let's see what is the sample question of today, and so that you can also check your voting pads. So the sample question is, N.R. Narayanan Murthy advocated for dash hours work week, and your options are A 60, B 70, C 78, and D 65. And your time starts now. So time is up. Let's see what is the answer. So the correct answer is 70. He advocated for 70 hours work week. So with this, I introduce our first quiz master, Dr. Annapurna Kumar. She has done her MBBS from St. John's Medical College, Bangalore, followed by her MS from Mysore Medical College. She is a former professor of ophthalmology and currently a PG teacher at Aravind Eye Hospital, Pondicherry. She is the creator of YouTube channel AP's Ophthalmology Pearls with more than 25,000 subscribers and more than 290 videos, and for daily quizzes for the last 2 years. With this, I hand over the screen to Dr. Annapurna ma'am.
Hello, everyone. Very happy to be here. First of all, I'd like to thank the organizers for this opportunity. And since the PGs will all be very eagerly waiting, I won't waste any more time. We should directly go to the quiz. So, can I have the first question, please? Section 1. The differential diagnosis of the condition in the picture includes all of the following conditions except. Can I have the choices? Tyrosinemia type 2, acanthamoeba keratitis, healing corneal epithelial defects, microsporidial keratitis. Your time starts now. And the correct answer is microsporidial keratitis. Explanation. So microsporidial keratitis, unlike all the others which have a dendritiform pattern, shows coarse punctate epithelial lesions. Tyrosinemia type 2 is also called Richner-Hanhart syndrome. There's an accumulation of tyrosine, and this is associated with photophobia due to corneal edema and dendritiform pattern and palmoplantar hyperkeratosis. Next question, please. An 18-year-old presents with night blindness for the past 10 years and diminished vision. He is found to have mild posterior subcapsular cataracts, and the fundus picture is shown here. What sort of diet is recommended for patients with this condition? Your choices are A. Avoid mainly meats, nuts, and pumpkin seeds. B. Take a lot of fish liver. C. A gluten-free diet. And D, there is no diet restriction. Your time starts now. And the correct answer is A. Avoid mainly meats, nuts, and pumpkin seeds. Explanation. So this is basically a gyrate atrophy of the choroid. This is due to an inborn error of metabolism, and there is an accumulation of ornithine, which is largely derived from dietary arginine. And therefore, one should restrict dietary arginine, pumpkin seeds being a particularly rich source of arginine. So next question. A 3-year-old male child born out of a consanguineous marriage presents with a history of persistent eye movements from birth and delayed milestones. Findings include nystagmus, dilated non-reactive pupils, and a flat ERG. Past records show a normal fundus at birth, but presently the fundus picture is as shown in both eyes. This is most likely to be. Your choices are Leber's congenital amaurosis, X-linked recessive retinitis pigmentosa, congenital syphilis, congenital rubella. Your time starts now. And the correct answer is Leber's congenital amaurosis. So all the features, especially nystagmus with a normal fundus at birth, are quite classic. And most of these cases have hypermetropia. And this condition occurs due to a disruption in the visual cycle. Next question, please. An 8-year-old boy.
Hello. No, it's not. I can see I'm just hearing the voice, but it is not.
An 8-year-old boy complains of blurred vision in the left eye for 2 weeks. There is a left RAPD and the fundus shows disc edema with a macular star. What information from the history is in keeping with the most likely diagnosis? Your choices are juvenile onset diabetes, blunt trauma to the orbit, a pet cat at home, history of joint pain. Your time starts now. The correct answer is a pet cat at home. So the diminished vision with RAPD, disc edema and macular edema is a classic picture of neuroretinitis, which most often is caused by cat scratch disease. This is caused by infection with Bartonella henselae. And this organism can also cause Parinaud's oculoglandular syndrome. Next question. A 25-year-old male with a history of a road traffic accident presents with diminished vision, a right proptosis, diminished extraocular movements, conjunctival chemosis, RAPD, arterial pulsations on fundus examination, and a choroidal rupture. Intraocular pressure is difficult to assess because of tight eyelids. The left eye, of course, is normal. What is the immediate course of action? Your choices are topical steroids and anti-glaucoma drugs, CT orbit to rule out optic canal fracture, intravenous methylprednisolone, canthotomy and cantholysis. Your time starts now. And the correct answer is D, canthotomy and cantholysis. So the presence of proptosis with arterial pulsations indicates an acute retrobulbar hemorrhage causing a vision-threatening rise in intraocular pressure. So in canthotomy, the lateral canthal tendon is cut, and in cantholysis, the inferior crus of the lateral canthal tendon is cut, and both of these help in evacuation of the blood. Now I shall introduce you to the next quiz master.
तेरे में voice जाएगी
The next quizmaster is Dr. Lipi Chakrabarti, who is currently heading the Ophthalm department at CCM Government Medical College in Durg, Chhattisgarh. She's also the director of Lipika Netradham at Durg. She has a fellowship in glaucoma and has numerous paper presentations, journal publications in both national and international journals, and has been an invited faculty at various state and national conferences. Over to you, Dr. Lipi.
Yeah, thank you, Dr. Annapurna. Quiz competition, I believe that you're not competing with your fellow contestants. Rather, you should take it as a competition with yourself so that you emerge as a better student. So may good luck be with you. Over to my questions. So can I have my questions? Yeah, so the first question for you is, the amorphous hyaline deposit found in granular corneal dystrophy, as shown in the adjacent pic, that stains which color with Masson's trichrome stain? And the options are blue, red, reddish blue, or is it none of the above? Your time starts now. Yeah, so coming to the answer, can we have the answer here? Yeah, it is red in red. That's the option B. Masson's trichrome, it is having three colors, and there is not much explanation to this. This irregularly shaped, well circumscribed breadcrumb-like deposits, which is bright red with Masson's trichrome, are visible in the stroma in case of granular corneal dystrophy. So we move on to the next question. What is true about green disease on optical coherence tomography, OCT, with regard to glaucoma? The choices are A, disease is present but not diagnosed. The option B is no disease is present, but scans look concerning. Option C, seen in high myopes. And the last option is disappears on repeated OCT scans. Green disease and red disease, right? Time starts now.
आवाज तो
Time
मेरी
starts
से आ
now.
रही है फिर
Yeah, so was this an easy one? We come to the answer. Green disease means false negative. So disease is present, but it is not diagnosed. This is because the data which are stored in OCT. So coming to the explanation, green disease is when the OCT software interprets actual glaucomatous damage as normal because of the misleading data which is fed in the software. So this leads to a false negative diagnosis, and red disease is just in contrast to this. So I think we can move on to the next question. Characteristic of herpes zoster dendrite are all except herpes zoster and herpes simplex. So herpes zoster dendrites characteristic are all except. So first, they stain brightly with fluorescein dye. Second option, they are pseudodendrites. C option, they are shorter and stockier. And D option is usually peripheral with no terminal end bulbs. The time starts now. So coming to the answer, was this a confusing one? The correct answer is they stain brightly with fluorescein dye. The explanation is these pseudodendrites, they stain with fluorescein dye, but they show minimal staining unlike HSV. So unlike the dendrites of herpes simplex, which stain bright green with terminal bulbs, HZO pseudodendrites, these are non-erosive mucus plaques. So they exhibit minimal staining with fluorescein green. The next question. The question is, clinical signs characterized by Brew heard over the closed eye during systole with a stethoscope in Graves' eye disease, in Graves' ophthalmopathy is known as? What is the name? A, Kocher sign, B, Berry's sign, C, Gold-Sizer's sign. This is a proper noun, so we can pronounce it anyway, I think. And D is Reisman's sign. Your time, I think there is some discussion going on in the background. Huh? Time starts now.
This meeting is being recorded.
Yeah, so what do you think the answer is? Coming to the answer, this is Reisman's sign. Somebody mumbled it in the background, or I heard it wrong. I don't know. So Reisman's sign, very confusing signs in thyroid ophthalmopathy. Huh? This is a clinical sign characterized by Brew. I think somebody had host had muted me. Okay, I think this is the last question. Right. So now we move. Yeah, I think I have another question left. Right.
Yes.
So
Yes,
this is the next question, the last question of this round from me. The question is, the classical triad of visual loss, optic atrophy, and optociliary shunt vessel is found in which disease? Options are A, optic nerve glioma, B, optic nerve sheath meningioma, C, optic nerve hypoplasia, and D, Leber hereditary optic neuropathy. Let's start the timer. या तो ये तो इजी वाला था. आंसर क्या है इसका? That is optic nerve sheath meningioma. Explanation is simple. These are the clinical features, actually classic triad for presentation: slowly progressive painless monocular vision loss, optic atrophy, and optociliary shunts. So I think I am done with my set of questions.
yes, ma'am.
Yeah.
So I think
And-
Annapurna ma'am again. Yes.
Yeah, so we'll come to the first question in section 3. An 80-year-old comatose patient in the ICU is found to have severe exposure keratitis in the left eye. There is a history of multiple corneal transplantations in that eye for old herpetic corneal scarring with no useful vision. Which of the following is an acceptable palliative treatment for the same? Your choices are Fricke flap, Kuntz-Szymanowski flap, Gunderson flap, and tensor semicircular advancement flap. Your time starts now. The correct answer is C, Gunderson flap. So the Fricke and tensor are flaps used for lid reconstruction. The Kuntz-Szymanowski procedure is used for ectropion. Gunderson flap is a full thickness bipedical conjunctival flap used in severe corneal conditions in eyes with poor visual potential. So next question. A 55-year-old pseudophakic male gives a history of unilateral chronic low-grade uveitis that responds only partially to topical steroids. You suspect chronic endophthalmitis, which is the most common organism responsible for chronic postoperative endophthalmitis. Your choices are Cutibacterium acnes, atypical mycobacteria, Staphylococcus epidermidis, and Bartonella henselae. Your time starts now. The correct answer is Cutibacterium acnes. This was formerly called Propionibacterium acnes. Cutibacterium acnes is the new name. Okay, next question, please. A 55-year-old male who underwent phaco with IOL 3 days back complains of severe pain and redness in the operated eye. Vision was hand movements. Signs included flare, cells, and hypopyon. Distant direct ophthalmoscopy shows hazy media. According to the EVS, which of the following treatment modalities is indicated? Your choices are immediate vitrectomy with intravitreal antibiotics, topical and systemic antibiotics alone, vitreous tap and start intravitreal antibiotics after the culture report, vitreous tap followed by intravitreal antibiotics. Your time starts now. The correct answer is D, vitreous tap followed by intravitreal antibiotics. So the EVS or the endophthalmitis vitrectomy study, here the decision to treat depended on the presenting vision. So a presenting vision of hand movements or better was to be treated just by tap and antibiotics. Whereas if the presenting vision was PL or worse, then an immediate vitrectomy was required. Next question. A 25-year-old comes to you with the following spectacle prescription from elsewhere and asks you whether he has astigmatism at all or not. What type of refractive error does he have? Your choices are mixed astigmatism, simple hypermetropic astigmatism, no refractive error, simple myopic astigmatism. Your time starts now. And the correct answer is simple hypermetropic astigmatism. So when both the sphere and the cylinder have the same numerical value, it is a simple astigmatism. You will understand this better if you transpose the prescription. Next question. A 20-year-old female comes to you saying she was told by her eye doctor that she has Malatia leventinus. Which of the following would describe her fundus appearance? The choices are A, B, C, and D. Your time starts now. And the correct answer is A. So, Malatia leventinus is another name for familial dominant drusen, also called Doyne honeycomb retinal dystrophy. So, as you can see, the other conditions like choroideremia, angioid streaks, and fundus flavimaculatus are quite characteristic. I shall now introduce you to the next quiz master, who is Dr. Urmil Chawla, currently at PGIMS Rohtak. She has been at this institute since her undergraduate days and has over 20 years of teaching experience. She specializes in orbit and oculoplasty. She has held various posts in her college and at the state and national level. She has numerous papers and book chapters to her credit and has received numerous awards, including the Distinguished Ophthal Professor Award in 2022. Over to you, Dr. Urmil.
Thank you so much, Dr. Annapurna ma'am, for the kind introduction. And as we move forward, best wishes to all the students. I hope you've been doing excellent in these three sections and continuing with the mixed bag of questions as they are coming. We'll just push off to the next section 4 and we have few questions. My first question is from the strabismus section and your question is the minimum required diagnostic criteria to diagnose infantile esotropia is option A, the range of the angle of strabismus is 40 to 50 prism diopters. Option B, in some children, neurological status is abnormal. Option C, the refractive error correction eliminates strabismus in some children. And option D, asymmetric optokinetic nystagmus characterized by robust temporal to nasal response and erratic nasal to temporal response. So your time starts now. So the correct answer is option D, asymmetric optokinetic nystagmus characterized by robust temporal to nasal response and erratic nasal to temporal response. Hope you've got it right. And as I would go forward with the explanation, I've tried to explain you with the considering the MCQ so that you know which choice you have taken and why it is right or wrong. So according to the PEDIC studies, the minimum required findings for diagnosis of infantile esotropia, which you know occurs before the 6 months of age. And in that, usually the esotropia may be 40 to 50 diopters, but the range is 10 to 90 diopters. Then the neurological status is it is normal except for the strabismus part. Refractive error is expected for the age, that is moderate hyperopia may be there, but correction of that does not eliminate the esotropia. So all the three ABC options were not correct. And the right answer is option D, which is the specific feature of this condition, that is asymmetric optokinetic nystagmus characterized by robust temporal to nasal response and erratic nasal to temporal response. And this is specific for this condition. So going to the next question. The next question is the standard management option for type 2 Duane syndrome includes option A, surgery of the extraocular muscle can eliminate innervation abnormality in some cases. Option B, abnormal head posture can be corrected by surgery in over 80% of the cases. Option C, surgery is commonly performed to improve fusion. And option D, prisms are commonly used to treat anomalous head posture. Your time starts now. And the correct answer is option B, abnormal head posture can be corrected by surgery in over 80% of the cases. And going to the explanation, as you know, type 2 Duane syndrome, it comprises 5 to 10% patients presenting with exotropia in primary gaze and abnormal head turn towards involved side. So it is an adduction deficit that happens. It's a neurological disorder that is present, and surgery does not eliminate the fundal abnormality of innervation. The success rate in eliminating an abnormal head position is 79 to 100%. That is more than 80%, as the option said. Surgery does not improve motility, stereopsis of fusion, and a prism can be placed at times on the patient's glasses to correct for the face turn, but it is not commonly used, making this option also wrong. So option B was the correct option.
Urmil ma'am? Urmil ma'am?
I think our Zoom is frozen, madam.
Her?
Yes.
Okay, so we will move from, I'll start the quiz from this question. So the question number 4.3 is, a 7-year-old girl presents to the eye emergency department with sudden onset of convergent squint. Her immediate management options include option A, base in prisms on the contralateral side. Option B, bimedial recession as an urgent procedure. Option C, Botox on the ipsilateral lateral rectus muscle. And option D, cycloplegic refraction and prescribe the glasses. Your time starts now. So let's see what is the answer. So the correct answer is option D, that is cycloplegic refraction and prescribe the glasses. So the child has presented with acute onset of concomitant esotropia. And this is an uncommon form of strabismus having no obvious neurological cause. So there is no role of prisms in front of the squinting eye or bimedial recession or the Botox. So the correct option is option D. Moving to the next question. A 2-year-old girl presents with bilateral severe ptosis with obstruction of both visual axes. Her eyes are set far apart. Her father has similar features. Which of the following surgical procedures is likely to be the most efficacious for the following scenario? Your options are A. Aponeurotic repair, B. Frontalis suspension with silicone rods, C. Levator resection, and option D. Frontalis suspension with facial slings. Your time starts now. So let's see what is the correct answer. It is option B, that is frontalis suspension with the silicone rods. So ptosis in the setting of blepharophimosis epicanthus syndrome is typically managed with frontalis suspension. So traditionally in a child below the age of 3 years, the amount of fascia lata available is usually insufficient and therefore synthetic slings like silicone rods are the preferred material. Coming to the last question of this section, which of the following statements regarding ocular surface squamous neoplasia is correct? Your options are A. Patients with OSSN should always be screened for HIV. Incidence has been estimated at around 1 to 2 per 10,000 per year in Caucasians population. It usually presents as a unilateral vascularized mass at the inferior fornix area. Bowen's disease is a type of OSSN that affects the conjunctival basement membrane. Your time starts now. So the correct answer is option A, that every patient with OSSN should be screened for HIV. So it is a broad entity comprising of spectrum of squamous neoplasms of conjunctiva and the cornea. It may manifest as the first sign of HIV in some cases, hence the significance of screening. So with this, now I invite Dr. Akanksha Pandit. She is the youngest quizmaster of today's episode. She has done her MBBS from Bairamji Jijiboy Government Medical College, Pune, MS from Pravara Institute of Medical Sciences, Ahmednagar, and she is presently doing her fellowship in medical retina at Sankara Eye Institute, Shimoga, Karnataka. She has presented multiple presentations at state and national level. She has publications in International Journal of Scientific Research and Nigerian Journal of Ophthalmology. Her interests are, she is a chief organizer for Cultural Inter-College Festival Vedant 2013 at BJ Government Medical College, Pune. She was a lead performer and participant in Firodia Karandak 2014. She has won multiple awards in badminton and other sports. She has participated in various educational camps, eye donation camps, and public awareness street plays. She has also participated in multiple quizzes, inter-college competitions, and organized various events related to these. So with this, I hand over the screen to Dr. Akanksha Pandit. Welcome, Dr. Akanksha.
Thank you, ma'am, for the kind introduction. Without wasting any further time, I would like to wish all the participants good luck. And here we go ahead with the section number 5. So the first question is, identify the condition in the adjacent figure. Your options are A. Axenfeld-Rieger syndrome, B. Iridocorneal endothelial syndrome, C. Iridoscheisis, and D. Iris atrophy. Your time starts now. Okay, so the correct answer is option C, iridoscheisis. It is a rare condition which is defined as a separation of the anterior iris stroma from the posterior stroma and the muscle layer. And most of the times it is associated with some or the other form of glaucoma. Whenever the iris strands float in the aqueous humor, they create a shredded wheat appearance. And this is what we call as iridoscheisis. Moving to the second question. The ability of light wave from a laser to form interference fringes with another waveform from the same beam separated in time is a measure of its A. Temporal coherence, B. Spatial coherence, C. Polarization, D. Directionality. Your time starts now. And the correct answer is option A, temporal coherence. Basically, coherence expresses the potential of two waves to interfere. So the temporal coherence characterizes that how well a wave can interfere with itself at different times. And it also let us know that how monochromatic a light source actually is. Moving to the third question. This sign is a pathognomic feature seen in which condition? Your options are open globe injury, B. Host cell glaucoma, C. 8-ball hyphema, and D. uveitis glaucoma hyphema, that is UGH syndrome. Your time starts now. So the correct answer to this is ghost cell glaucoma. The following condition mentioned actually is a candy stripped appearance, which is a characteristic sign of ghost cell glaucoma. In this condition, the AC is filled with small circulating tan-colored cells. And when it is mixed with fresh RBCs, so two or more differential layers of cells can be seen, with the lighter khaki-colored layer of ghost cells appearing on the top of a heavier fresh RBC layer. This actually imparts the candy stripped appearance. Coming to the next question. The near point of a fully accommodated hyperopic eye is, your options are, it is beyond minus infinity, optically speaking. Second, it is beyond infinity, optically speaking. Third, it is behind the eye. And fourth, you need additional information to determine the fully accommodated zone. Your timer starts now. And the correct answer is option D. You need additional information to determine the near point. So basically, near point, it is a point in space conjugate to retina when the eye is fully accommodated. In order to evaluate the exact location of the near point, we will also need to know the refractive error of the patient to assess the near point. So this information is not adequate to determine the near point. Coming to the last question of the set, identify the following condition. Your options are neurosensory detachment, B. Pigment epithelial detachment, C. Bacillary layer detachment, and D. None of the above. Your time starts now. Okay, so the correct answer to the following question was bacillary layer detachment. So bacillary layer detachment, it is a OCT, optical coherence tomography finding, in which we see a split between the photoreceptors immediately posterior to the external limiting membrane within the photoreceptor inner segment, that is myoid zone. Okay. Here I forwarded to next quiz master, the sixth set of question.
So now it's time. So the first set of questions is over. Thank you all the quiz masters. So before moving to the next question, it's time for the commercial break. So now it's time to declare the winners of the last episode, that is episode 7. So these are all the winners from the PG categories and also from the private practitioners. So at the end of the quiz, we will let you in so that we can interact with you. So whoever name is, this phone numbers are displayed, please message in the question answer or the chat box so that we can let you in at the end of the episode. And also for all the participants, as today is the last preliminary round, so the result of the teams who have been qualifying for the 4 quarterfinals, we will be selecting the 80 teams. It will be declared by the next week. So please be at a look so that you can know whether you have been qualified for the quarterfinals or not. So all the best to everyone. So with this, we move on to the next section, that is section 6. I again invite Dr. Annapurna ma'am.
Thank you, Dr. Shilpi. We'll start with the first question. A 55-year-old male presented with diplopia of 2 weeks onset, vision and fundus were normal both eyes. Pupils were dilated, reacting only to near and not to light. Horizontal and inferior movements in the eye were normal. On attempted upgaze, there was upgaze deficiency in addition to jerky convergence movements and backward movement of the eyeballs. What is this condition? Your choices are A. Dorsal midbrain syndrome, B. Bilateral isolated superior rectus palsy, bilateral inferior oblique palsy, and a nuclear oculomotor palsy. Your time starts now. The correct answer is a dorsal midbrain syndrome. So these findings are classical for Parinot's dorsal midbrain syndrome, also known as Sylvian aqueduct syndrome. So the classical features are that of mid-dilated pupils with right-near dissociation, upgaze palsy, convergence retraction nystagmus, and bilateral lid retraction. Next question, please. A 68-year-old female presented with a 68-year-old female presented with a 1-week history of double vision and dizziness. Right eye shows an abduction deficit, normal vision, 2 millimeter ptosis, small pupil, no RAPD. Left eye is normal vision, external examination, and anterior segment. What is the most likely diagnosis among the following choices? Your choices are right abducens palsy with senile ptosis, right abducens palsy with left Addy's pupil, intracavernous carotid aneurysm, and a right abducens palsy with physiological anisocoria. Your time starts now. The correct answer is intracavernous carotid aneurysm. So this combination of an abducens palsy with an ipsilateral Horner syndrome localizes the lesion to the cavernous sinus. Next question. In which of the following conditions would you most likely expect to see an eyelid squamous cell carcinoma in an 8-year-old? Your choices are A, B, C, D. Your time starts now. And the correct answer is A, that is xeroderma pigmentosum. So the basic defect in xeroderma pigmentosum is deficient repair of DNA, which is damaged by UV radiation, as a result of which these individuals are prone to premature skin aging and skin malignancies. Next question, please. With respect to density of scotomas, which of the following is the odd man out? Your choices are MACTEL2, blind spot, retinoschisis, retinal detachment. Your time starts now. And the correct answer is D, retinal detachment. So, in contrast to the others where you get an absolute scotoma, RD is the odd man out because here there is a relative scotoma. Next question, please. Patient reports worsening ptosis and diplopia with use of topical beta blockers. What is the most likely explanation for this? Choices are: patient may have oculomotor palsy, patient may have myasthenia gravis, patient may have CPEO, or patient may have Horner syndrome. Your time starts now. The correct answer is B. The patient may have myasthenia gravis. So, of all the given conditions, this exacerbation with topical and systemic beta blockers occurs only in myasthenia gravis. So, now I'll hand over to the next quiz master.
Yeah, I think this is Dr. Lipi. It's me again with the next set of questions. So, Bakapol scores can get turned any moment. Can I have the first question? Yeah, so the first question in this series is severe headache, diplopia, visual loss, ophthalmoplegia, and subarachnoid hemorrhage caused by a sudden increase in the size of pituitary tumor is seen in or is called as. The options are A, pituitary aneurysm, B, craniopharyngioma, C, ocular blunt trauma, and D, pituitary apoplexy. The time starts now. Yeah, and the answer is obvious. It is D, pituitary apoplexy, in which all these features are seen. So explanation is pituitary apoplexy that is caused by sudden increase in the size of pituitary tumor. Mostly it is pituitary adenoma. This is often secondary to hemorrhage. And in this condition, we find all the clinical features which has been mentioned in the question. Coming to the next question. A 25-year female complains of decreased vision 3 months post LASIK surgery, and she has following or adjacent anterior segment OCT finding. Now, this finding is suggestive of the options are flap dislocation, interface haze, pressure-induced stromal keratitis, or is it epithelial ingrowth? Timer, please. And the answer here is not C, because mostly we used to think if we are not getting anything, let's go with the one jo sabse lamba hai. So it's not always the case. The answer here is epithelial ingrowth. Right, coming to the explanation. Epithelial ingrowth after LASIK, it is a rare but a known complication. Although this is often evident on clinical examination, but OCT imaging that helps in a definitive diagnosis. It shows the extent of the epithelial ingrowth and looks something like the image which has been shown in the question. The third question of the series. And the question is, which brainstem syndrome includes ipsilateral third nerve palsy and contralateral hemiparesis in extremities? The choices are A, Benedict syndrome, B, Weber syndrome, C, Northangel syndrome, D, Tolosa-Hunt syndrome. Timer, please. Many scientists, names of all scientists, and the answer is, yeah, it is Weber syndrome. Explanation, Weber syndrome, this is classically described as a midbrain stroke syndrome and superior alternating hemiplegia. This involves all these structures and this causes ipsilateral third nerve palsy with contralateral hemiparesis. The fourth question is, which of the following is widely used intralesionally for the management of orbital lymphangioma? Options are A, propranolol, B, non-steroidal anti-inflammatory drugs and NSAIDs, C, corticosteroids, and D, bleomycin. Timer starts now. Yeah, the answer is here is again not B, lamba wala answer nahi hai, it is D, bleomycin. Now, this is theory, explanation of this is not much. It is just known in theory and practically intralesional bleomycin in lymphangioma is an effective and safe non-operative modality of treatment. The final question, fifth question. A 14-year-old basketball player with blonde hair. So this patient presents with the clinical picture shown in right. Carefully see the picture, you will be getting the diagnosis, and then we go to the question. The appropriate dietary therapy for the patient is, options are A, vitamin A, B, vitamin B6, simple, A, vitamin A, B, vitamin B6, C is vitamin D, and D is low phenylalanine diet. Timer starts now. Yeah, coming to the answer. So what is the diagnosis? This is homocystinuria, intranasal displacement of lens. And the answer was vitamin B6. So features of homocystinuria, they include all this: blue iris, marfanoid habitus, ectopia lentis, intranasal dislocation is seen, and treatment includes oral vitamin B6, B12, and folic acid. So I think I'm done with my set, and I invite, I think it is Dr.
Annapurna ma'am again.
Annapurna madam again. Yeah, so please, madam, you can take over.
Thank you, Dr. Lippy. So, hi, me again. Shall we have the first question, please? So, based on which of the following studies was ranibizumab given FDA clearance for intravitreal use? Your choices are Rise and Ride, Bravo and Cruise, Marina and Anchor, Harbor and Cat. Your time starts now. And the correct answer is Marina and Anchor. So these were the two landmark trials that led to the FDA approval of ranibizumab. Rise and Ride were for diabetic macular edema. Bravo and Cruise were vein occlusion studies. Harbor and Cat were for AMD, but the protocols were different. Next question. The convalescent phase of VKH syndrome is characterized by depigmentation in various tissues. In which location does depigmentation occur first? Your choices are perilimbal, choroid, eyelids, eyelashes. Your time starts now. The correct answer is A, perilimbal. So basically, depigmentation occurs in all of these locations, but occurs first perilimbally, often within 1 month. And this is also called Sugiura sign. Next question. The following picture shows the appearance of the disc during routine fundus evaluation. Which of the following is not an indication for neuroimaging in a glaucoma suspect? Your choices are neuroretinal rim pallor, rapid progression of visual loss, defective color vision, visual field that respects the horizontal midline. Your time starts now. And the correct answer is, so obviously visual fields that respect the horizontal midline are a characteristic feature of glaucoma, so they don't require any neuroimaging. But on the other hand, the other conditions are not characteristic of glaucoma. Also, if the visual fields were respecting the vertical midline, then definitely that is an indication for neuroimaging. Next question, please. So a 60-year-old male presented with a history of seeing objects double. Which of the following statements is the most complete and unambiguous definition of binocular diplopia? Your choices are: it occurs only when both eyes are open, it disappears when the unaffected eye is closed, it disappears when either eye is closed, it persists when the unaffected eye is closed. Your time starts now. And the correct answer is C. It disappears when either eye is closed. See, basically, when you say diplopia is present when both eyes are open, that occurs also in monocular diplopia. The second choice, disappears when the unaffected eye is closed. It's not a complete definition. Okay. The fourth choice is the classic definition of monocular diplopia. So the third choice, disappears when either eye is closed, is the most accurate definition. Next question. A 65-year-old female presented with a picture of oculomotor palsy. Which of the following oculomotor subnuclei is single and midline, because of which involvement of this subnucleus results in bilateral involvement of the muscles supplied by it? Your choices are: medial rectus subnucleus, Edinger-Westphal nucleus, superior rectus subnucleus, central caudate nucleus. Your time starts now.
लग रहा है चार्जिंग है.
The correct answer is D, central caudate nucleus. So this supplies the levator and is the only single unpaired subnucleus of the oculomotor nuclear complex. I'll now hand over to the next quiz master.
Urmil ma'am.
Yeah, thank you, Annapurna ma'am. Sorry for the interruption that happened in the previous section. After all, however advanced we may become, we are still slaves of technology, and it abruptly just failed me. Anyway, just proceeding to section 9, going to the first question of section 9. Best of luck to all students. Which of the following statements about rhabdomyosarcoma is correct? Option A, the most common extracranial solid childhood tumor. Option B, embryonal and alveolar subtypes have distinct genetic alterations that may play a role in the pathogenesis of the tumor. Option C, orbital tumors are more likely to have alveolar histologic subtype. And option D, orbital tumors commonly present with ophthalmoplegia. Your time starts now. So the right answer is option B. Embryonal and alveolar subtypes have distinct genetic alterations that may play a role in the pathogenesis of the tumors. So coming to the explanation, rhabdomyosarcoma is the most common primary orbital malignancy in children, with approximately 30 to 35 new cases per year. But it is not the most common extracranial childhood solid tumor. It is third after neuroblastoma and Wilms tumor. As I said, option B is the right one, that the two histological subtypes are distinct genetic alterations. They play a role in the pathogenesis of these tumors. Orbital tumors are characterized by embryonal histology, not with the alveolar histology. And orbital tumors produce proptosis more commonly, and very occasionally ophthalmoplegia may be present. Going to the next question. A newborn is referred with tense non-pulsatile swelling located below the medial canthus. The immediate management includes option A, opine with the pediatrician and commence systemic antibiotics as prophylaxis as the risk of secondary infection is high. Option B, observe for 2 weeks during which time most will spontaneously improve. Option C, organize an urgent MRI scan to make an accurate diagnosis. Or option D, surgical treatment is necessary to remove the swelling in most cases. Your time starts now. So the right answer is option D. Surgical treatment is necessary to remove the swelling in most cases. Going to the explanation, as you could make out, it was a dacrocystocele. It usually presents with tense blue non-pulsatile swelling, and the landmark is that it is below the medial canthus and it's present shortly after birth. Systemic antibiotics generally have no role in prophylaxis. Conservative management with observation for 2 weeks can be an option, but most swellings do not improve spontaneously due to that. The clinical appearance is classic, so generally we do not have the need to go for an MRI. However, it may be done only if we wish to exclude meningocele and meningomyelocele. But in these cases, clinically, the lesion is above the medial canthus. So generally, MRI is not needed. Surgical management, which is initially generally probing, is promptly required in most cases as acute dacrocystitis may set in or respiratory difficulties may develop. And it is most of the time successful, done in reliable hands. So probing helps in relieving with this dacrocystis. Going to the next question. Which of the following is most commonly found in ptosis secondary to aponeurotic dehiscence? Option A, low skin crease. Option B, normal levator function. Option D, reduced Bell's phenomena. Or option D, reduced marginal reflex distance. MRD2. Your time starts now. So the correct answer is option B, normal levator function. So going to the explanation, you know that features of aponeurotic dehiscence include high skin crease, normal levator function, reduced MRD1, unaffected Bell's phenomena, and normal orbicularis function. Low skin crease is not a feature of this. It is generally seen in congenital ptosis. Normal levator function is definitely present. Reduced Bell's phenomena is not its feature, and this is a feature of chronic progressive external ophthalmoplegia. And MRD2, you know, it means the alteration in the position of the lower lid, and it does not it is not related to the upper lid. So that too is not the right option. So normal levator function was the right option. Going to the next question. A 15-year-old male presents with the finding as shown in the figure. Additional examination findings would include option A, hyperpigmented macules. Option B, adenoma sebaceum. Option D, port wine stain. Or option D, conjunctiva telangiectasia. Your time starts now. And the right option is adenoma sebaceum. So the picture which you saw was, it shows an astrocytic hematoma commonly seen in tuberous sclerosis. Other manifestations of tuberous sclerosis include hypopigmented skin macules, facial angiofibromas, mental retardation, and seizure disorder. So hyperpigmented skin macules, which was the option, it is not seen in this. It is seen in incontinentia pigmenti. Adenoma sebaceum is a feature of this condition. Port wine stains are associated with Sturge-Weber syndrome, and conjunctival telangiectasias are seen in Lewis-Barr syndrome. Going to the last question of this section. A 36-year-old asymptomatic male is referred by his optometrist for the following ocular findings given in the figure. All of the following facts in history may be pertinent in determining the underlying diagnosis, except option A, history of liver transplantation. Option B, history of high-risk sexual behavior. Option C, history of polydipsia, polyphagia, and polyuria. And option D, history of multiple non-specific episodes of weakness and numbness. Your time starts now. And the right option is option D, history of multiple non-specific episodes of weakness and numbness. So as you see, the given figure shows the appearance of multiple peripapillary cotton wool spots in an asymptomatic patient. These can be characteristics of interferon retinopathy, and interferon is a medication often used in patients with a history of liver transplantation, so an associated history is pertinent. HIV could be a differential diagnosis for cotton wool spots, and in this same, the history of high-risk sexual behavior may be associated. Again, diabetes and hypertension are common etiology of these, and hence the association of polydipsia, polyphagia, and polyuria. However, history of multiple non-specific episodes of weakness and numbness, it refers to a patient with multiple sclerosis who would not have this fundus appearance. Patients with MS may develop optic neuritis or an intermediate uveitis. So making this the right option. So with this, I complete this section, and may I request the next
Sure.
quiz master, I think Dr. Akanksha, to take over.
Before,
Thank you, ma'am.
yeah, Akanksha.
Heading
just-
towards the last set of questions. My
Akanksha,
first question from the 10th section is,
Akanksha, wait a while. Before
am I
we-
audible, ma'am?
Yes, you are audible. I
Yes.
just want to make one announcement. Before we complete our section 10, our next quiz will not be on 13th of March because of the All India Ophthalmological Society conference. So it will be on 20th of March. So please mark your calendars. The first quarterfinal will be on 20th of March. Dr. Akansha, now you can go ahead.
Okay. Here we start. Section 10, question number 1. Recently FDA approved drug for geographic atrophy is a option A, pegylated complement C3 inhibitor. Option B, pegylated complement C3A inhibitor. C, pegylated complement C5A inhibitor. And D, pegylated complement C3B inhibitors. Please make sure which option you are marking. And the correct answer is option A, pegylated complement C3 inhibitor. So the recently approved drug is pegcetacoplan, which is a pegylated complement C3 inhibitor peptide, which inhibits the C3 convertase, preventing cleavage of C3 into C3A and C3B, and thus preventing inflammatory response and opsonization respectively. Coming to the next question. The following statement about diffuse unilateral subacute neuroretinitis is correct. Option A, visual loss typically continues after successful eradication of the subretinal nematode. Option B, the disease never occurs bilaterally. Option C, the condition is seen only in individuals with history of travel to endemic areas. And option D, DUSN is a common cause of incorrectly diagnosed unilateral retinitis pigmentosa. Your time starts now. And the correct answer is option D. DUSN is a common cause of incorrectly diagnosed unilateral RP. So, it is a multifocal chorioretinitis caused by a nematode, most commonly Toxocara canis, and they usually present as subretinal tracts, focal RPE changes, and small white subretinal specks, which, like these features, mimic retinitis pigmentosa, and so usually it is misdiagnosed. Coming to the next question. Two tumors commonly associated with so-called masquerade syndrome are option A, eyelid sebaceous carcinoma, intraocular lymphoma. B, conjunctival lymphoma, choroidal melanoma. Option C, basal cell carcinoma, retinoblastoma. Option D, conjunctival lymphoma, intraocular lymphoma. The time starts now. And the correct answer is option A, eyelid sebaceous carcinoma and intraocular lymphoma. So normally masquerade syndrome, it is a simulation of an inflammatory condition by a neoplastic process. Various tumors are associated with it, and out of the following mentioned tumors, the commonly associated were intraocular lymphoma, sebaceous carcinoma, and leukemia, and various others. So next question is, blue vision is caused by which of the following drugs? A. Tamoxifen, B. Digoxin, C. Sildenafil, and D. Chlorpromazine. Your time starts now. And the answer to this question is B. Digoxin. Digoxin is usually like associated with multiple visual disturbances like decrease in visual acuity, central scotomas, photopsia, and dyschromatopsia, which includes yellow vision, that is xanthopsia, synopsis, blue vision, and chloropsia, green vision. Normally, yellow and green are mostly affected, but synopsia is also one of the features of digoxin toxicity. Heading towards the last question of today's session, and it is, the following picture shows a hyperpigmented area, which of the following like contains branches from which anatomic structures? Your options are short posterior ciliary artery, B. long posterior artery, C. anterior ciliary artery, and D. can be either from A or B. Your time starts now. The right answer is long posterior artery. So the explanation is, these are axon-filled nerve loops, and they are the loops from the long posterior ciliary artery and nerves within the sclera, often located 2.5 to 3 millimeters posterior to the limbus. With this, we complete our set 10, and I hand over to Shilpi ma'am for the further explanation.
So with this, we are over with the last preliminary round of this season, basically. So next episodes will be of the quarterfinals, and the first episode, as I already informed, it will be on the 20th of March at same time, that is 8 p.m. and 20 teams out of the 80 teams will participate in the quarterfinals 1. So, first of all, Harshvardhan Chilkoti.
Am I audible, ma'am?
Yes, yes.
Ma'am, am I visible?
Yes.
Good evening, ma'am. Good evening, panelists, everyone. Good evening, Urunul, ma'am.
Good evening. Good evening.
Uh,
Good to see you.
I secured the first position in private practitioner last round.
Okay, congratulations.
Thank you, ma'am.
Last year you were in the PG category, I think.
Yes, ma'am. Previous year we were third team in the final. Yes, ma'am.
He's a student of our college, our institute. So a proud moment for RIO PGIMS Rohtak. Congratulations. No more with us, but still our alumni.
Thank you, ma'am.
Students will
Great.
always.
Yeah, students will always.
Thank you.
So, Prateek Prabhu.
Good evening, ma'am.
Good evening, ma'am.
So can you please introduce?
I'm Pujita.
I'm Dr. Prateek,
We are from JSS Mysore.
JSS Medical College, Mysore, final year PGs.
Okay. Annapurna ma'am, you can ask him anything beyond ophthalmology.
I did my PG from Mysore Medical College, so we are Mysoreans, co-Mysoreans.
Nostalgic memories.
Yeah.
So, who is your mentor?
Dr. Soumya HV.
Okay, Soumya ma'am. Yes.
Yeah,
ma'am,
Ma'am is
yeah. Hello, Dr. Shilpi.
Nice.
He's from our LDP batch.
Yeah. Yeah. Nice to see that one of our our team came in one of the top 10 winners. That's nice. Thanks to you and sir for the beautiful brain teasers every year. Thank you
No,
so much.
thank you so much, ma'am. Dr. Amruta? Dr. Amruta? Wasavi Karuparthi.
Good evening.
Good evening.
I'm Dr. Vasti, final year postgraduate, Andhra Medical College.
Okay. So you're from the private practitioner category
Oh,
or?
ma'am, no, I'm PG category.
Okay. So where is your partner?
She's hot.
She's not there. Okay. Lipi ma'am, you can just interact with her.
So what is it in South that I'm getting all the winners from South? No mention of Central. and
Literacy
North.
rate is very high.
I also was at Arvind and Sankara Netralaya. So I think that, yeah, really they are hardworking and studious. So congratulations, Vasavi, and good luck for the coming episodes. Thank
We
you.
can ask Akanksha also. She is from Sankara.
Yes, ma'am. I am currently doing at Shankara Institute, Chimoga.
Okay, yes, you are in Shimoga. Okay, yes. So other are Drishti Kaushal.
But your questions were great, madam. Dr.
Nice, so
Shilpi will
nice.
take care. Yeah,
Nice,
questions.
Shilpi. I talked to Sai at that time urgently. I said he said Shilpi ma'am is taking over. Thankfully, Shilpi ma'am, great to
Ma'am,
see you manage.
don't call me ma'am first
Okay,
of all.
Shilpi. Thank you so much.
Okay, the Shruti Nair are consistent winners. So this time you were which position? The last time?
Last quiz we were first.
First. So, Urmil ma'am?
All
They're
young
all
brains,
top 10.
beauty with brains, all four of them I can see. Young, smart females with so much of brains getting first and second positions. And the quizzes are definitely tough, I would say. ये आज वाली भी, it's, I think, moderate to hard questions are, tough questions are there. And good to see all of you solving them also. So great to see all of you keep the good work done. And soaring
Initially,
height should
with
be
the
your
easy
target.
questions. Yeah, initial episodes were of the easy question. So we
Now
thought
I think-
everyone is scoring so well. We are underestimating them. So
Yeah, so because Dr. Shilpi told that you are a consistent winner, then I would like to throw the point which I threw at the beginning also, that winning isn't about winning over others. It's something like winning over yourself. So in the
improving
forthcoming
upon your
episodes,
own
I think,
self.
yeah, so the
Yeah.
forthcoming episodes, I think
Keep-
you will continue doing that.
Yeah, keep improving upon your own self. That is the real target you should have.
Yes.
Which
last one is
institution are you from? Shruti Nair and
We're from Jipma, Pondicherry, ma'am.
Okay, great.
ma'am, again, any connection?
I did my senior residency in Jipma, so yes. there's a connection.
That's why I asked this question.
World is a small place. Annapurna
Yeah.
ma'am, world is a small place.
So the last one is Dr. Purvasha Narang. Like Shruti Nair is the consistent winners, she is our consistent mentor who always log in at the
Hi,
beginning.
Purvasha. Purvasha is a nice friend of mine. You are muted, Purvasha. You are muted.
Lovely
Good
to see you, ma'am. Good evening.
Good to see you also after such a
Hi,
long time.
Shilpi. Hi, Dr. Lipi. Hi, Dr. Annapurna, ma'am.
Hi.
Hi, Dr. Akanksha. Hello. So yes, we are the late entries into the quiz, but then yes, I think it was a great quiz again. Lots to learn. Even at this age, we are still learning. Thanks to
Definitely.
Shilpi and her consistency.
No, we
So
are
you're-
missing Dr. Prashant today.
Oh,
And
yes.
I was about to ask, where is Dr.
He's
Prashant?
out of coverage area, basically.
Okay.
He tried to log in, but
Okay.
somehow the coverage is not there.
Okay. But Purvasha being one of the best mentors is not at all a surprise.
Oh my God.
Because since when I have been knowing her, she's always been excelling. When she was in Haryana, and now I think you are in Nagpur.
In Nagpur, ma'am. Yes.
Nagpur.
ma'am. Thank you so
कोई बात
much.
नहीं, Haryana is missing you. हम तो you we'll consider you as an Haryanvi.
Ma'am, my heart is there.
Yeah.
Right.
हम
ma'am.
हरियाणवी अच्छे ही रहते हैं.
हाँ.
Yes, ma'am.
You look so young, Dr. Purvasha. I was thinking that whether it's a mentor or a participant, what Dr. Shilpi
Oh my God. Thank you so much, Dr. Lippy. And the quiz was really well conducted by you also. I enjoyed it and lots to learn, like so many new things coming up, these names and all. I think it's really a tough competition between all of them, and they are doing so well, consistently performing so well. And I think PGIMS Rohtak is also doing a great job holding the flag in Haryana, like really thanks to ma'am and her academic endeavors.
No,
She
it's always
really-
a team effort, and our entire department
And-
is excellent under Dr. Chauhan sir. So we all
Yes,
happy
ma'am.
with it. Chalo.
So anyone training side?
Shilpi, there's a question here. I think Dr. Vasavi is asking a question. How many teams will qualify for the quarterfinals?
Ma'am, I've
That's what she-
already explained the 80 teams. 80.
Out of how many teams?
300 plus.
Yes, 400 plus.
400 plus. Amazing.
So Drishti question?
Hello, ma'am. Are we audible?
Yes.
Yeah, you're audible now.
Finally.
Good evening, everyone. We are we are from Shimla, team IGMC. I am Dr. Arshi Ratan. She is Dr. Drishti Kaushal. We are third year residents.
So last year you played? No.
No, ma'am. Our
You were
seniors
there.
were there.
Your seniors were there. Yes.
Yes, ma'am.
So we can see you're enjoying the winters of Shimla.
The
Yes.
never-ending winters, ma'am.
Lovely. We've
Blue and
started
pink,
our
huh?
summers already.
Pardon,
Blue
ma'am?
and pink. You have chosen great.
It's
blue
just
and
a coincidence, ma'am.
पूरा combination है.
Akansha, कुछ पूछना है?
Ma'am, I would really like to thank you for giving me this opportunity. Like, no, forget about the participant, but here I would like to tell you that this is such an educative session for me. Like, rather than questioning them, I only am learning so much from this. So this was a very good session for me. And for them, like, it's really good to see them so proactively participating and achieving so much at this level. It's really great. Congratulations to all of you all. It's really nice.
You're right. Actually, na, what we do is after we specializes in branch, na, we are always, it's like limited to this. It's a tunnel vision for us.
It happens. It
Yes.
happens.
So with all these mixed bag and everything, na, we also learn what is recently going on.
Right. And it's amazing to see that these girls and boys have got so much exposure to these fancy questions and names and all. They're so aware of things. It's really amazing to see that. Like, we were not like this in our PG. Really, I can speak for myself and my other people, but I don't think we were so
Your
aware.
seniors are sitting here, so what will they say then?
True, ma'am.
है ना?
No, but they have real good hard. They're working hard. Yes.
Definitely.
So when the
But-
going gets tough, the tough gets going.
Exactly.
We are here to identify the toughest, huh? Because the questions in this series, what I felt, they're a little tough. And what 10 second to 5 second to question समझने में ही चला
हाँ,
जाता.
चला
And that tick, 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 tick is so dangerous.
Shilpi, that's a clue to you now.
Increase the timer or what?
Decrease the volume, maybe.
Decrease the volume.
The asset is that there is no negative marking. तो वो जो 10 होने से पहले कुछ तो ठक मार ही दो. बस वो वाली
मैम
बात.
अभी क्वार्टर फाइनल्स आएंगे, अभी देखते हैं शिल्पी
हाँ,
के
देखते हैं।
पिटारे में से क्या
हाँ,
निकलता है।
MCQ नहीं रहते हैं नेगेटिव मार्किंग, बट यस उसमें फेस टू फेस भी वी आस्क क्वेश्चंस इन क्वार्टर फाइनल्स एंड उसमें नेगेटिव मार्किंग रहती है, तो अब डिफिकल्टी लेवल
और
और बढ़
डिफिकल्टी
जाएगा।
बढ़ेगी नेचुरली। वही
ये इजी था मैम। शी इज सेइंग दिस।
इसमें क्या है, कहीं पे भी बैठे हैं एट द एंड ऑफ द सीन आप वो कर रहे हैं, मतलब इट विल बी फेस टू फेस फ्रॉम क्वार्टर फाइनल्स।
Don't blame the quiz masters, huh? We were
No.
told कि थोड़ा सा tough question देने का है,
Yes,
लेकिन
definitely.
हम तो बहुत इजी देते हैं।
अरे मेरे को मैम यही फीडबैक मिलता था कि क्या इतने 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 इजी क्वेश्चंस पूछ रहे हैं करके, ये तो सबको ही आ जाते हैं, तो इसलिए फिर हमने कहा चलो।
Actually, even if the question is easy, it's a question of fastest finger first. So that's still, even if it's easy, it's okay. The faster the person, of course, it probably also depends on the internet connection also. But yeah.
Ma'am, the young generation is not like us. They can do multiple things at a time.
Who said you are not, who said you don't belong to the young generation?
No, ma'am, not not the generation of Akanksha.
Not at all, ma'am.
We all are young and we should remain young at heart. Just forget
That
it.
is a
That's
different.
right.
We all have
Ma'am,
to
you are a
remain
role
young.
model.
No, we all have to stay
Evergreen,
young.
ma'am.
That's all.
No.
Madam, they
I think
declined to
nobody-
become a promoter.
Okay, not an issue. So it's 9:35. So thank you,
घर से पूछना सर
the
आप
youngest one, Dr. Akanksha, Lipi ma'am,
Thank you so much, ma'am. It's a
Urmila,
pleasure for
and
me.
Annapurna ma'am. Special thanks to you for last minute support.
No
आप दिख
problem.
रहे थे, वो कह रहे थे ऑन
I
करना।
enjoyed it actually.